I'm Dr. Robert Anderson, and I'm in the Springfield, Massachusetts office. Well, there's three types of abnormal veins, if you will, in the vein area. First one would be a spider vein, which is less than 1 millimeter. Then there's ones we call reticulars that are 1 to 3 millimeters in size. That's the diameter of the vein. And then varicose veins, which are greater than 3 millimeters in diameter. All three of those can potentially rupture. Well, the most common one that we'll see is bleeding. Most typically, it's in patients who are having bad vein disease for a number of years, and they've damaged the skin around their ankles. And the most common scenario is when they've taken a shower and they're toweling off down by their ankles. All of a sudden, a bunch of bleeding starts, and it's just coming from the smaller veins, but the pressure's so high that it literally will squirt across the room. Well, the most common one is neglected vein disease. It damages the skin over the long term, and the skin's really our protection against bleeding and ulcer formation so that we don't run into problems with those things. Well, the most common one is bleeding. If you lose a lot of blood, obviously that can even be life-threatening. In a vein situation, the easiest way to stop the bleeding if you're by yourself is lay down and elevate your leg above your heart, because then the pressure is taken out of the venous system. So it almost stops it completely, and probably will with a little pressure if somebody's available to help with that. Or if you've got it elevated and you can bend up enough to put pressure on it, that'll stop it as well. Well, there's several. The first one is bleeding from smaller veins that the pressure head is feeding into. The others are clots, blood clots. Those are major problems for people across the country. Not always related to varicose veins, but if you have varicose veins, that puts you at a 4 times greater risk for blood clots than if you didn't have varicose veins. The other major problem that venous disease causes is damage to the skin that can lead to ulcers and sores down at the ankle. And those are very painful. Once they occur, it's kind of like being in pain constantly. The best thing is, like we mentioned, elevating your leg above your heart. That takes the pressure out of it. And if somebody else is available to help put pressure on the area, and then an ACE wrap around the area is an easy way. Most people have ACE wraps around their house. Simple way to stop the bleeding. And then just keep it elevated. The other option along with that is a little ice pack, because ice makes the veins constrict, so they're less likely to bleed, and that sets up a situation where blood clots can form to prevent the bleeding from continuing. Typically, if you go into the emergency room, they'll probably just put pressure on it. Sometimes they'll put a suture in it to try and stop it from bleeding. The biggest thing is pressure. But if you come to like a vein center, the easiest way to take care of it is pressure, but then also inject the veins that are feeding into that area to close them down. We call that sclerotherapy. If they're actually bleeding at the time, that's a temporizing measure to make the smaller veins basically close down. Then if you're going to really treat the underlying problem, which is the bigger varicose veins, then you need a detailed ultrasound of the leg to identify all the bad veins, and then a treatment plan after that so that you would go through to prevent future bleeding problems. Well, the ruptured varicose vein is more of if it's bleeding externally, more of an issue just to get the bleeding stopped. The ultimate treatments for those, both whether it's bleeding or not bleeding later on, are virtually the same. The biggest thing is trying to keep the skin as healthy as possible. If you have vein disease, it tends to dry the skin, especially in the winter time. So moisturizing the skin at least once a day is helpful. The other big thing that is a mainstay to pretty much everything we do with varicose veins is compression. So compression stockings that are what we call graduated. They're at a higher pressure at the ankle, less high as they go up either to the knee area or above the knee into the thigh area. One thing that also can occur, it's less likely and it's usually related to a little bit of trauma. It could be mild trauma, but it could be a little bit more significant, is directly traumatizing a varicose vein. That can lead to bleeding underneath the skin that won't come out, but you'll get a severe bruise. And if you're on a blood thinner, you could have a collection of blood we call a hematoma in the area. Usually, again, ice and direct pressure to the area will control it because it's a low pressure system. The other thing that can occur along with that, if you do have a trauma to a varicose vein, is you can start getting blood clots in the varicose veins because they've been damaged and there's pressure from the blood collecting around those veins that can cause blood clots in those veins. The danger with that is they can extend into the other veins that are abnormal as well, or even normal veins rarely. So you always want to be cognizant of, is this progressing? You're getting more redness in the area, hard lumps that feel like blood clots on the surface. And if you are, you definitely should be evaluated.